Hello, you and your partner, you have just found out that you're pregnant. When are you supposed to see a doctor? Immediately, after 3 months, or when you feel that you're unwell? I would love to know what you think. Kindly drop your comment on the comment section below. If you are new here, welcome and thank you for joining us. Don't forget to subscribe because here we talk about important things. We talk about preconception care, the importance of early antenatal visit, and preventable neural tube defect. Before we get started, I have an insight to share. Did you know that many of these pregnancy complications can be prevented by just visiting the clinic early? Many women and babies are lost every year, not because doctors they don't know what to do, but because care came too late. I'm Christine Zarandeje, your registered nurse. I'm so excited about our today's topic. We are going to talk about the importance of early antenatal care. When are you supposed to start it and how it helps to protect the baby and the mother? So grab your seat and stay with me until the end because this information is important for you and your loved ones. So let's get started. Now, what is antenatal care? Antenatal care, it is the health care. Some people they refer to it as NC visit. This is the health care given to a woman during pregnancy. Why is it important? It is important because it helps the healthcare workers to monitor the health of the mother, to monitor the growth of the baby during pregnancy until delivery. It is important also because it helps them to identify any problem during pregnancy so that it can be addressed as soon as possible. It is also important because it helps to reduce pregnancy complications such as high blood pressure, severe anemia. So those are some of the complications that are associated with pregnancy. Now, this antenatal care, they are for all pregnant. They are not for those who are feeling unwell. So get me right. The antenatal care, they are for all pregnant women. So if you're pregnant, kindly purpose to attend your first antenatal visit. So when are you supposed to start it? Antenatal care should be started as soon as you have confirmed that you're pregnant. Ideally, it should be before 12 weeks after conception. Why? Because at this point, your baby's organs are forming, the woman's body is adjusting, and preventive measures work best at this time. So, taking too long, you are delaying the benefit of this care. Now, what really happens when you go for your first antenatal visit? So let's narrow down on what happens when you go for your first antenatal visit. There's so many things that happen, but we'll try to highlight the important things that to you and your baby. So first things first, the healthcare worker will have to confirm that you're pregnant. Even if you have already done it at home, they'll have to do it again to confirm that you're pregnant. They'll check your height, they will check your weight, they will take your blood pressure, they will take a medical history so that they may know if you're having any condition, so that they manage it as soon as possible to ensure you have a smooth journey during your pregnancy period until delivery. They also test your blood and urine. On the blood, mostly they check your hemoglobin level, that is your HB level. Ideally, it should be above 10 grams per deciliter during pregnancy to be on the safe side. But it can be more than that. Also on the urine, they will check if you're having any infection so that treatment can be started as soon as possible. They will also assess your nutritional status. Here, it is when you are given health education on the healthy diet that you need to take during your pregnancy journey. Here, it is when supplements are started. You are given your folic acid, you are given your iron supplements, and you can also receive an injection that is called tetanus toxin. This is an injection that helps to prevent a dangerous disease called tetanus for your unborn baby. Now, why all these checks? These checks are really important. Why? Because they help to detect risk as early as possible, even if there are no symptoms. So these checks are really important. They are not boring. They are very important for you and your unborn baby. Now, let's talk about what are the benefits if you start your antenatal care early. Yes, there are several benefits if you start your antenatal care early. Number one, it will help to detect high blood pressure. Why? Because you have started your antenatal care early. If you're having any high blood pressure, it will be managed as soon as possible so that it might not. Another benefit is that it helps to prevent severe anemia. Why? Because this is when you are given health education about healthy eating habits during pregnancy. You are being given iron supplements. Your hemoglobin level is being checked regularly so that it will be maintained at the required range. As you have said earlier, it should be above 10 grams per deciliter during pregnancy or higher to be on the safe side. Another benefit is that if you're having any infection, it can be managed on a timely manner so that it may not affect your pregnancy or your baby, because some infection can be transmitted to the baby. Another benefit is that if you start your antenatal care early, it will help to promote healthy growth of your unborn baby. Another benefit is that it will reduce pregnancy and delivery condition. Why? Because if you're having any condition such as severe anemia during pregnancy, benefit is that it will help to prepare the mother physically and emotionally during the pregnancy journey until delivery, so that the mother will be okay mentally, the mother will be healthy, so that there will be no any problem during your pregnancy period. Now let's talk about early care and baby's development. The baby's brain and spinal cord, they form in the early weeks of pregnancy. This is why folic acid is given early, so as to prevent neural tube defects. This is why nutritional advice is given early, so that you may take the required diet during pregnancy, so that to prevent some complications such as severe anemia. Some health condition, this is why some health conditions are managed during pregnancy, so as to prevent complications during pregnancy and delivery. So early care and baby's development, they are related because they help to prevent some of these neural birth defects, and they also help to reduce pregnancy and delivery complications. What are the risks if you don't start your antenatal care early? There are several risks if you don't start your antenatal care early, which include the health problems will go undetected. Which health problem? Some conditions such as high blood pressure, some conditions such as severe anemia, diabetes in pregnancy. These are dangerous conditions that they require immediate intervention during pregnancy, prevent complications during pregnancy and delivery. Another risk is that you will be required to have emergency delivery. You will be required to have emergency cesarean section. That could be how you started your antenatal care early. Another risk is that there will be pregnancy complication and delivery complications. As we have said earlier, the benefits are so many. The benefits outweighs the risks. So if you start your antenatal care early, you'll avoid a lot of complications during pregnancy and also delivery. There will be also another risk is that there will be poor outcome for the baby and the mother. Some they even lose their life during delivery, and some they also lose their baby during delivery. So if you start antenatal care early, it will help you to carry a healthy pregnancy until delivery, so that the outcome also for the baby and the mother. So let care delays the opportunity for prevention. Now, what are the role of partners and families in antenatal care? Families and partners, they play a major role by encouraging pregnant mother to start the antenatal visit early, by also supporting them with transport, and also reminding them about the appointments, because antenatal care, it is done monthly until you deliver. In case you're having complications, or you're having high blood pressure, or you are carrying twins, that is a high risk pregnancy, it can be done weekly or after 2 weeks, depending on your healthcare provider. Early antenatal care is essential. Why? Because it helps to protect the health of the mother during the pregnancy period. It also helps to promote healthy growth of the baby, and it also helps to prevent avoidable complications. So if you are pregnant, kindly purpose to start your first antenatal visit. If you are planning to get pregnant, prepare early. If you found this video helpful, kindly like, share, and subscribe at Nurse Educates Healthy Beginning. Our next video will talk more about neural tube defects. Until then, bye.